Good morning, everybody. Like Carrie said, my name is Louis Borba. Lumar Dairy Farms. We're in Turlock, California. I want to thank DCHA and Merck for inviting me to come speak to you guys today. Like Carrie said, we milk a little over 1,800 cows, have close to 1,900 replacements. We farm about 1,100 acres for corn silage, and we have about 150 acres of alfalfa hay. We also have a heifer ranch where our heifers go when they're about 8 months old, and they come back when they're about 200 days pregnant. We have 20 employees. One of those is my herdsman, Tony, and I have 2 farm managers for our 2 farming locations. So I don't have to do it, I guess. But so yeah, like Carrie said, my parents immigrated to America from the Azores with a dream, and the American dream. So they came over, started milking cows at local dairies, and then by the late 1960s, they bought their first group of cows. And on a rented facility, it was my dad and his 2 brothers. Fast forward to the early 80s, we bought the real estate that our dairy sits on now. And in 1986, we built that dairy. And by the late 80s, the brothers decided that their families have grown and we should split up. So they broke everything up into 3 buckets and drew numbers out of a hat. And if you didn't like it, you could put your number back and grab a different number. So I don't think it was really a split. It was whatever they wanted. So in 1994, Lumar Dairy was formed. My dad, Louis, my mom, Maria, and my 3 sisters, Fatima, Helen, and Anna Marie. And I graduated high school in 2000, and I went straight to the dairy. I didn't want to go to school, so I just worked with my dad. And he had me doing everything on the dairy, from milking cows when the milker didn't show up to relieve the feeders and the cow feeder, the calf feeders. And I was still in the dairy with him. And so over time, he just gave me more and more. And we worked well together. He was forward-thinking. He was always improving the cow to be more efficient genetically, management practices. He always listened to my ideas, even when Brant would call me and say, "Have you heard of RFID?" And I'm like, "Yeah." So I'd tell my dad, and if it can make us more efficient, let's do it. So he was always letting me bring in new technologies to the dairy. And so in video should be playing, but it's not. Yeah, here we go. So I'm married to my wife, Stephanie, of 13 years. We have a set of twin girls, Charlotte and Amelia, that are 12, and a son, Louis, who's 9. Stephanie also kind of has the same kind of story that we do. That her father was an immigrant, but he was a custom harvester and started a custom harvesting business, was very successful. And my mother-in-law's family had a dairy, so they had a herdsman run their farm. And in 2015, he retired, so me and Stephanie stepped in to run her family's dairy. The neat thing about that farm is Lucky Lady Farms. That's her great-grandpa's facility that we're currently running. So that's 2 different spectrums, right? Multi-generational, and we're first generation. So we run both dairies. I run them the exact same because it's a lot easier that way. Same vet, same nutritionist, same protocols. My father-in-law actually built the same calf barn that I have before I met my wife. So I walked in, it was the same exact setup. So that was nice. So some of the day-to-day stuff, since I have to be at 2 locations, is I go to Lumar first. I live 2 minutes away from the dairy, so I go to Lumar first. I just oversee what the cows are doing, what they did yesterday on milk production, see what they're doing on dry matter intakes, and then I go to my Young Stock Sense Hub computer, look at the calves, get all my paperwork ready for the calf feeder, so she can go treat. I look at my cow monitoring, see how the cows are doing, see how they ate, see if anything's out of normal in the routine. And then if there's nothing pressing, then I just go to Lucky Lady, do the same thing over there. So I split my mornings and afternoons at both facilities. Other than the vet checks and certain things, I try and hit both dairies, both days. Lumar's, like Carrie said, we have young stock monitoring and cow monitoring. Lucky Lady does not have calf monitoring, but they have cow monitoring, so it's a little bit different there. I treat the calves at Lucky Lady every morning with the calf feeder, which is at Lumar. I only do it on Tuesdays. I'm not doing it today because I'm here, but the calf feeder is off every Tuesday, so that's my day to walk the calf barn and make sure protocols and everything is staying in line. So that's my day-to-day deal. And we milk twice a day. So the milkers get there at 4 in the morning and they're done by noon, and they get it at 4 p.m. So typically when I get here in the morning, we're about halfway. We just started milking, so typically if there's an issue, they'll come talk to me. And I get to see the cows going to the barn if there's any issues. And I like data, so I'm constantly tracking everything. So I can go back and see what the cows did 3 years ago at this exact time of the year to see if there's any differences, what's going on. And the calves, I typically, like I said, I walk them every Tuesday. We also, like Carrie said, raise show calves. My mother-in-law is a big show, and really big in the show world. And we have some genomic animals, so depending on when we're calving some extra special calves, I'll spend more time in the calf barn just to make sure that nothing's going wrong with those. Even though everybody is valuable, some calves are just built different. And like I said, our cows we milk twice a day. We're currently milking about 86 pounds twice a day with like a 395 butter fat. We're on a full off-sync, pre-sync, or modified double off-sync program now on first service. Second service is 100% off the collars. And we're on a sexed semen and beef semen protocol. So first 2 services are sexed semen. Third is conventional, fourth is beef, or your straight Angus first service all the way through your lactation. We have a 54 stall carousel. We built it in 2003. We put milk meters. We didn't have milk meters in the beginning, but in 2010, I think it's 2010, we put in DeLaval milk meters. And that was really nice to have daily milk weights. And they're fairly accurate on the ID response. And we can push about 310 cows an hour with 4 milkers and 1 guy pushing cows and 3 milkers in the milk barn.
Which activity system are you guys using again on cow?
SenseUp. And our nutritionist comes in once a month just to go over any change, just a normal nutritional consulting meetings, go over feed management, inventory management, how are the cows doing. Our vets come in, we have vet check every Wednesday morning. So if there's any issue, we can go walk calves if we have to. If not, it's not necessary, but vet check is every Wednesday. And typically, we have our feeding program, feeding plan, and I've been with Pine Creek for a few years now. My nutritionist, Steve, I've been with him now for 2 years. I switched it up a little bit, it's been a good working relationship. And my nutritionist, Steve.
So the goal of our nutrition plan at Lumar Dairy is to maximize homegrown feeds, utilize our forages, utilize our homegrown feeds, at the same time create consistency from day to day. Minimizing variation is the key to maximizing milk flow and productivity. So we're constantly focusing on checking dry matters, checking forage quality, checking feed quality, and keeping things the same. We utilize technology, both on the cows and on the calves. On the cows, we use feed management software to help us monitor intakes, make daily changes on dry matters, things like that, where if it rains, we could change dry matters of feeds on the fly, utilizing SenseHub ear tag technology, which has been kind of a game changer as far as managing the calves from day to day. We've seen death loss go in the right direction since using those tags. We've seen weaning weights go up as far as weaning weights at 120 days, right? If we're comparing to what a typical calf ranch would do, right? They're always looking at 60-day weights, 120-day weights out of the weaning pens and things like that. Monitoring those numbers on farm, treating it kind of like a calf ranch, we've seen those numbers increase. I think due to the fact that we've saved a lot more calves by identifying those calves and not necessarily treating all those calves. It might just be some more hydration, giving that calf a little therapeutic treatment. It's really helped increase the total number of heifer calves that Louis has on farm. At the end of the day, we're in the margin business, and making more hundredweights makes us more margin. So the goal of our nutrition plan.
So just an overview, if anybody has any questions. So on our calf management program, everything starts in the maternity pen. We have 2 maternity pens that are bed and pack, that are bedded down with almond shells. Since we have a ton of almonds in California, almond shells is cheap bedding. And so we keep our 2 maternity pens. We have one side that we try and devote to 2-year-olds, first calf heifers, and then the other side will be mature cows. Obviously, when we're having a big flush, it doesn't always work that way, but that is the plan until it goes haywire. But when the calf, so we have 3 outside guys that the first guy gets there at 3 o'clock in the morning, and the last guy leaves at 5:30 p.m. Their number one responsibility is the maternity pen when they get to work. When they get to work, they go to the maternity pen, see who's calved, who's going to calve, and and then they can kind of schedule the rest of their day depending on the pressure in the maternity barn. So first thing they do is they tag the calf. They put the visual tag in one ear, RFID tag, and the SenseHub tag in the other ear. They write down the dam, the calf ID, and if they know what time she was born, they write that down as well. And then they go heat up colostrum. And our goal is 1 gallon in the first 2 hours. That's our goal. And we bottle feed all of our calves. So if they can drink at least 3 quarts of colostrum, they get a green stripe on their back. So that way the calf feeders know that this calf got at least 3 quarts of colostrum into her. If she didn't want to drink very well or stubborn, then she gets a red stripe, so then maybe the calf feeders can try colostrum as a second feeding or just that calf just needs more attention. But we do the best we can. Obviously, we have a big window from 7 to 3 a.m. where nobody's on the dairy watching the babies being born, but it's just I don't have a night guy, so it's just the cost of doing business at that point. But during the day, though, we do our best. And so the calves will be there for, depending on when they're born, a couple of hours. Candy and her sister Paloma will grab the calves, take them to the calf hutch, put iodine. Our calf barn was built in '04, and it's about 312 calf pens, all stainless and plastic, with a freshwater flush underneath it. It's got a water bucket and a grain bucket in front, and the water's on valve. So you just open the valve, and it fills the buckets of water. And we outgrew that calf barn. I got a wild hair to raise all my Angus crosses, and then outgrew the calf barn. So I think we have like 75 of these outdoor calf hutches. And when I stopped raising my Angus calves, we just added this to part of our calf rotation. So just depending on when they're born is when they get to go outside or inside. We just keep it as part of the rotation. And we have Candy and Paloma, our calf feeders. Candy is the calf manager. She's been with me since she'll be 2 years this September. Their number one responsibility is just feeding calves. They don't necessarily feed calves colostrum, but the minute that calf has colostrum in it, it's their calf. So we feed, after we harvest the colostrum from our fresh cows, we keep those fresh cows in a transition pen for up to 3 days to get their transition milk. So we use that transition milk for all the babies that are under 2 weeks old. So for the first 14 days, they get 2 quarts twice a day of transition milk that's pasteurized. After that, when they hit 15 days old, they switch over to 3-quart bottle twice a day of unpasteurized line milk at body temperature. I don't even heat it up. I just hook up to the pipeline, fill up my bottles, and go give the milk out. Typically, we try and keep it, the only thing really consistent is we try and keep it out of a certain pen every day. So then that way the butter fat doesn't fluctuate as much. So at day 15, they go to 3 quarts twice a day. At day 79, they go to 1 bottle a day. Then at 85 days, they're off of milk. And we keep them in the calf hutch for at least 10 to 15 days so that they get over the weaning process. They're over the milk. We start offering grain and water at day 2 or 3. And that grain that they get at day 3 is the only thing that is consistent all the way until they're 5 or 6 months old. They are on that grain until they switch to a TMR. So that's their security blanket whenever we move them to our group of 20 wean pens. Then from 20 they go to 40, and then from 40 they get moved to a group of 150. And so but the grain never changes, so that's their comfort. And so Candy, I make her paperwork. She's learned to do it when I'm not around. She can get what she needs, but she has her list. So Brant created a calf hospital list, just like my cow hospital list, and we have our young stock index, our health list. So she's got both. When she's walking the calves, she's going off the health index list, off of Sense Hub. And she'll stop, she'll examine the calf, determine what she needs to do, and then go to the next calf. But like this morning, we have 16 calves on our list for Sense Hub, and I have probably 35 on my hospital list that are on an active protocol. So that tells me that most of the calves responded to that treatment, but they're still on an active protocol. So we still look at them. It's more of a check-in. How are you doing? Are you doing fine? And so we always start at the youngest calf and finish with the oldest calf. And so our transition is every day I also make a list for Candy to know. So every day we have calves going from 2 quarts, 3 quarts, and every day we have calves being weaned until we have, say, 10 or 20 calves to come out of the calf barn at one time. But every day you have calves that are going through a transition. We also vaccinate in the calf barn for salmonella and Vista. So we record that into Dairy Comp to make sure whenever we have a spike on our health sum, we know why, and so that Candy knows why. And so we have 5 of these pens, 20 that hold 20 calves, and they stay in these transition pens for around 30 days. Yes.
Do you do monthly check-ins as a whole, like a department group? I don't know, like what's kind of like your managing style?
I'm on the dairy every day.
Right.
So like so I'll go and talk to the hospital guy. So I'm checking with them almost every day. It's not even weekly, right? So I'll go to Candy, how's it going? Like almost every day. My hospital guy, so we do a selective dry cow therapy and selective mastitis therapy. So I'm talking to my hospital guy every day. You're treating this cows need tubes, these cows need to go out. This cow's not getting better. You know, so we're talking constantly. My feeder is pretty easy. We talk like not as often as the other guys, but my milkers, every day I'm talking to them. My hospital guy, our breeder's a relief breeder, but I see him every morning before he leaves. And then Tony my husband is kind of the buffer. So he gets a lot of the stuff too, but I get what he can't handle, I guess. But I'm still out, and then I do that between both dairies. So if there's a fire in a certain area, then I will devote all my time to that. Like the calves, I lived with the calves for 5 months. And I made sure Tony the train didn't fall off the tracks on the other departments. But yeah, weekly those meetings I just talk to them every day.
Do you raise all the calves at the one?
Yeah, so they're completely separate, and we both raise calves at both places.
Oh, so you have 2.
2.
Okay.
We have 2 of everything. The only thing we don't have 2 of is nutritionist and vet, right? But everything else is 2.
Mi nombre es María Candelaria Negrete Flores y mi trabajo es alimentar las bebés y medicarlas para tenerlas en buen estado, que estén saludables y que estén fuertes, en buenas condiciones y cuidar que coman adecuadamente, que su comida esté limpia, que tengan agua limpia. Para mí, cuando empecé a trabajar con esto, pues se me hizo un sistema muy bueno porque nos ayuda a que no aumente el mayor número de bebés enfermas, que a tiempo las podamos atender. Y con el sistema, pues yo me voy dando cuenta cómo va mejorando o si va empeorando, o ahí me está diciendo cómo está la situación de la bebé. Cuando la bebé ya está cabizbaja, o sea, empieza como su energía a disminuir y ya no quieren comer bien. Entonces, en la lista, en el sistema, a mí me muestra que esa bebé está empezando a tener síntomas, como puede ser como en su respiración o en la comida. Tengo que diagnosticar de acuerdo a lo que me marca el sistema y de acuerdo a cómo yo veo la bebé. Pues me ayuda para actuar a tiempo y medicarla a tiempo para que no pase más días y ella empeore en su enfermedad. Entonces, a mí me ayuda mucho el arete porque me guía y yo puedo actuar a tiempo con la bebé y medicarla, diagnosticarla a tiempo. Y así la enfermedad no se expande, sino se mantiene controlado.
So, does anybody have any questions about the calf management side of it?
You mentioned you have calf hutches on the ground and the inside calf barn. Do you see a performance difference with either one of the setups?
So in the summer, I think the calves outside get hit harder because they have no cover on top of them. They're just straight, it gets hot. Like our summers can hit, it's not uncommon for us to have 105 for 20 days straight and freaks of 110. So outside in the summer is worse, I think, on the calves. So on average, maybe the calves outside are a little bit better because they have more room to walk around. It's just a bigger pen. But it has its drawbacks too, where the calf barn, it's controlled most of the time. They have shade. In the wintertime, I can close the curtains so they don't get wet. But outside, the calves they do better than I thought they would in the wintertime. We usually bed them down after a storm with fresh almond shells, and they usually stay pretty clean. It's just the summer is the worst part for them outside.
Can you talk a little bit about pre-SCR, now with SCR, like just the different systems pre and post, kind of how you did it and pros and cons of what you've seen?
Pre-SCR, I almost went to a calf ranch. That's where I was at. I couldn't find a calf feeder. And so we fed calf, we've never sent since the 60s, we've never sent our calves to a calf ranch. So I wasn't gonna do that, right? We have to raise our own calves. So we've had good calf feeders over the years, but like the last 6 years, I just could not find a calf feeder. And so when Brant called me, and I had the ear tags before I had monitoring on the cows. I believed in the technology. I wanted to wait till I got the best one, because something's always coming out. And so I knew SenseHub was good. I believed in it, but I wanted to wait. And then when Brant said, hey, let's try it on the calves, what's the worst that can happen? So I was basically waiting, thinking about going to a calf ranch. So I said, let's just try it. But I went through 3 calf feeders to get to Candy. I tried it does not make a bad calf feeder a good calf feeder. They're still bad. It doesn't help them at all because they don't know what to do without it. Because if they don't know what to do with it without the paper, they don't know what to do. They're just there. They're just stabbing, and they're not following protocol. They're just giving medicine and hope for the best. I even tried at one time my hospital guy who now runs my fresh cows with the collars, and he couldn't do it on the calves. He couldn't wrap his head around it. So when I got Candy, she was raw and she cared and she had talent. She just had she just needed to follow our protocols. And so that last ditch effort, I had a bunch of genomic calves and show calves being born, so I was in the calf barn. I didn't like what was going on, so I told her, I'm taking care of the calves now. So I walked the calves every day and gave her the paper to treat off of my protocol. And within a month, it just completely changed. Calves were getting better. We weren't IVing as many calves for dehydration. It was a complete 180. And I did that for 5 months. And I needed to get away because my wife and kids were saying, I needed to go on vacation. So I let Candy do it. And she bought in. So it wasn't her buying into the technology, it was her buying into my protocols. So once she bought into both, it was done, night and day. But it is not you have to have a good calf feeder because it does not lower mortality. It's just telling you, look at me. Then you need to decide what to do. So if your protocols are bulletproof, the medicines work. if you give it on time. And we used to do lung ultrasound scores, and we're saying, oh, you have lung scores of, your calves got pneumonia at day 24, but on HealthSum, I'm showing treatments at day 15. So when are they getting pneumonia? Is it when you actually finally see it at day 24, or is it day 16 or 17 when they're showing subclinical signs? Everybody has their pneumonia different, right? But it's just, you don't know. Anybody else?
I have a question. Can you talk about if you had a light bulb moment for when you realized that Sense Up Dairy Young Stock was truly working and making a difference?
Yeah, about 3 weeks into it, when calves started looking better and started responding to the medication. Like, we've had every expert in our calf barn, and they all told me the same thing. Your ventilation sucks. You have myco in your calves. You have ear tilt. Your ventilation's this. Everything's bad. I didn't change anything. My ventilation's the same. The only 2 drugs I use is Resflor and Draxin KP. I don't have any ear tilt. It's just early detection at the end of the day. We're catching these. So at Lucky Lady, I have a good calf feeder there. And he leaves me a list every morning on who to look at. And I know we are 4 or 5 days behind. By the time he's seeing it, and he's catching them early, we are 4 days late. The calves don't respond as well. My death loss is higher there. I just convincing my wife cause she runs that dairy, that's her dairy. So I'm trying to convince her to get air tags. She told me, I have you for now, so until I get, so that or I sabotage myself and lose some calves and she'll do it, but that's probably we'll do it there, just not right now.
Louis, on those outside calves, do you think it'd pay off to have shade cloths in the summer months?
Yeah, but the way that run is, it goes east and west. The sun it's going to be hard to have shade on them. It might be kind of hard, just the way our sun goes over those calves.
I do have another question. You had talked about the lists that are generated, and on some of those lists, you're able to identify these are the ones that are on a protocol. How did you generate those?
So we created in Sense Hub and Dairy Comp a calf hospital pin. So every day, like when we say it's day 1, Candy walks out there and writes down who she treats. We put in Dairy Comp every night. So every night, we record freshenings twice a day so that we can sync the calf tag to the calf, because it has to be done every day. And then we enter fresh, and then she has her list. So it gets into Dairy Comp, and the minute she's on her protocol, Sense Hub looks at her as in the hospital pin, and the light won't blink to save battery. But she's on protocol, so we still look at her. So the HealthSum list will have calves in pin 22 and pin 19 and 23, which is our group pins. Then the hospital paper will just have the calves' treatments, like what days, their day 4 of Draxin or day 7 of Resflor recheck. So it asks for a recheck. And then if they have scours, day 3, it's a recheck. And so she knows, okay, this one's day 2. Let's give her more, she follows the Dairy Comp paper for the treatment protocols.
And so your Sense Hub communicates with Dairy Comp?
Yes, they talk back and forth.
Gotcha, thank you.
Would you say that you'd had any false positives for treatment, and what has happened to your drug use?
gone down. So our reoccurrence has gone down. So the cool thing is when your Sense Hub list is smaller than your hospital list, because that means most of the calves are responding to the drugs because they feel better. So we're not catching them when they're on the ground. Like, we're catching them when they still look good. Like, you look at a calf and she looks completely healthy to you, and you have a hard time giving her a shot, but you have to trust the system that something is wrong with her. So you have to make that call. And most of the time it's right. There's very few times where I will not treat a calf and give her one extra day, but Sense Hub will push to Dairy Comp their health index if it's below 85. So you can look on your phone and realize, oh, she's an 80 today, she was an 82 yesterday, and Candy let her go one day because she looked great, but she's an 80 today, which is still a healthy calf, but she's going down subclinically. So we give them medicine, and you never see them again, most of them. So your reoccurrence is quite a bit cut back.
And has it driven more vaccine use?
Driven more vaccines?
Yeah, to try and prevent things.
No, we haven't changed our vaccine protocol. Like, we had salmonella in our calf barn years ago. I still vaccinate for salmonella even if I don't have it. And I still vaccinate with Vista at like 35 days old. Just what we did, because I don't want to stop doing a vaccine program just because the calves are healthier. They'll show up on the health index the next day. Like, it'll spike because they all got vaccinated. So Candy knows that those calves are just vaccinated. She won't mess with them. She'll leave them alone.
As the calves get older and you get to your transition feeds, going to your TMR, are you able to sense nutritional changes? And if you made the right choice or the wrong choice?
So I take the tags off at 5 months old. So when we vaccinate for brucellosis, I cut out the Sense Hub tag and put in their next visual ID tag. And they've already been on TMR for, say, 30 days at that point. So I don't see them anymore on monitoring. But what I've seen is if you get them bulletproof by about 200 days, they're fine, right? They've gone through all the transitions. We've monitored them through all their big transitions, that they're fine. The only thing is, like, you do get a rumination score on your calves. It's not 100% accurate yet, just for whatever reason. Brant can answer that question. But that's the next step, is getting that rumination number on these babies. Like, how good are they ruminating?
I have a question. You said that you have a fresh water flush under the calf hutches?
Yeah.
What exactly is that? Is that for, like, their watering, or?
Oh, no, so the calf hutches and the calf barn sit raised up, so all the manure and pit and urine goes to the ground. So instead of flushing it, because in California we flush with lagoon water, with our recycled water, but I don't want to put recycled water under my calves. So we have a fresh water tank that flushes the barn twice a day, just for that.
Louis, there's a question over here.
Hi, I have a question. You said that you don't have a maternity person at night. Do you have somebody that will give colostrum to the calves, or they
So
wait?
we don't have anybody.
Anybody?
I used to. When we used to milk 3 times a day, I had a night guy that did free stalls at night, and his job was maternity pin. But my milkers leave at 11:30 p.m. So regardless, I don't have anybody there from midnight to 3 o'clock in the morning.
Did you notice those calves have more disease compared to the ones born in the morning, during the day?
The only thing, they're not this, some calves drink off their mom, so they're probably drinking off their mom all night. So we don't know how much colostrum they got, but I know they got something because they don't want to drink, because if they hadn't drank anything, they would be hungry. And a lot of times they're not hungry. I just don't know how much they got.
Cool. Thank you.
basically looking at the data for the last couple of years since we started this. And the first one is his inventory is actually going up and not down. Since he put him in a couple of years ago, I sent him this graph the other day and he's up to 700 plus heifers in inventory less than a year of age. The other one that I really like to look at was the amount of retreats and recurs that he has after an initial diagnosis. So that was before he had the blinkies in. So basically what happens is calf gets a treatment for pneumonia. The way this graph works is if they get another treatment within 14 days, that's called a retreat. So they would treat a calf and then 70% of the time they were stabbing her again within 4 or 5 days, basically. So days to retreat is the bottom, the percent that got a retreat is the top. And then there was times when, it's the middle of winter, we got all this weather, it's cold, wet, all this other stuff. I mean, 100% of the calves are getting another treatment within 14 days. So we're going along with that. The blinkies come out, that basically dropped to 40%. And this last 2 years, we're running 20 to 30%, which is a lot more, way more normal than 100%. That used to be you'd walk through the barn and it was hack, cough, hack, cough, hack, cough all the way through there. Now it's pretty quiet. Louis was mostly concerned about was the amount of deads, and we went from sometimes 12, 13% deads to 2 to 3% deads a month. Partly because we're just getting the guys to get on the calves earlier and give some kind of intervention between finding them earlier, treating them earlier because of the blinkies, and stuff that goes along with that. The retreat rate dropped basically 3 times. So we went from almost 100% we're getting retreated within 14 days down to in the 20s. And the days for them to decide they wanted to retreat her went from 5 days to almost 9 days now. So that was a big savings in medicine.
Anybody have any more questions? I think that's it. Yep.
Just impressive that you can, you're going between the world of data and the world of hands-on and management on your farms. Are you the main data person?
Yeah.
So how do you justify your time? How do you make yourself look at the data and use that put as much time into that as you should compared to being out there?
Well, I mean, like you're talking about like on the monitoring side, or?
Mostly, yeah.
I mean, the calves are easy. Like the data there, when you get the list, when I treat my calves on Tuesdays, I can do it in 35 minutes, 40 minutes. Because I'm just walking. We have 500 calves that have tags on, more or less. I can walk those calves in 35 minutes. Because I only have 16 to look at today out of 500. So a lot of them is maybe they just need sustained pills and electrolytes, so that's quick. And once you get comfortable with the system and you're following your protocols, you walk up to a calf and she's on the list, you almost already know what she needs. Same thing with the cows. Like you have a cow on your monitoring list, you give her a shot of B12 and a ruminator pill and she's off. Or if she's a fresh cow, you're giving her something maybe Exceed. So it makes you more efficient, to be honest. You're not walking 500 calves. You're walking 20. So when I'm walking that calf barn, and if it's a big gap in between the next calf I have to stop to, I'm walking fast because I have to get places. And then Candy, like for her, she devotes all her time to treating calves. When her sister is the one that does all the watering, the grain, the general cleanup. So she devotes all her time. She takes more time than I do because that's her job. But she devotes all her time to those 15 calves.
what is your treatment or intervention for a scours outbreak?
So the funny thing is that the Sense Hub will show you a calf that just started scours. So she'll be like an 83 jumping on her calf hutch and have a little bit of scours. I know she doesn't have anything viral at that point. So she just gets 2 pills of Sustain and electrolytes for 3 days, twice a day. If at any time she starts to crash, Candy goes straight to an IV. So she gets a bottle of lactating ringers with dextrose and sodium bicarb, at least one of those bottles. We try and do 2 if we can, if the veins don't collapse. But she's pretty aggressive on IVing if she has to. I haven't had any viral recently, but we've had it, but we haven't had it more recent times. In the summer, she is even more aggressive on IVing. Like, even if that calf looks good and she did not drink her, because she makes them drink their electrolytes. Like, she'll sit there and make sure they drink it.
In between milk feedings?
No, so we feed the milk, and then maybe an hour later, she gets all her supplies, and she gives the bottle out. But she makes sure that they start to at least drink it. And typically, if she can get them drinking it, she'll go to the next calf. By the time she's done, probably 95% of the calves drink their electrolytes. But if they don't drink their electrolytes and they look worse, that's straight IV. Like, we don't wait another day, especially starting in June. Like, she knows when the heat comes, you're IVing even if they drink their bottle sometimes. We just have to stay on top of the IVing.
Thank you.
No. We had a horrible tubing experience with my family during COVID, so it never will happen again. I taught my wife how to tube in front of the kids, and I got a phone call, and so the calf didn't make it in front of the family. So my wife threw away the tuber, and it was at her dairy on top of it all. So we threw it away, and we don't tube.
Not colostrum, not electrolytes.
No. So if they don't drink their electrolytes, then they need an IV. They're not feeling well. So it's straight IV. I've force-fed colostrum when I'm run out of patience and I have to get going to the next dairy. Yes, I will force feed a bottle of colostrum if she doesn't want to drink. But the guys know not to do it. A calf will drink her colostrum early on. If you don't give her the chance to find her mom and she wants to drink, she'll drink it. Surprisingly.
You said you did thoracic ultrasounding prior to putting Sense Hub in. How long are you no longer doing the ultrasounding, and how long did it take you to make that decision not to continue thoracic ultrasounding?
We wanted to find out where our issue was. I used to do ultrasounding, total proteins, and daily birth weights. I do birth weights, 30s, 60s, and 120-day weights on my calves, just to find out where we were and where we needed to be. Once we figured out, so in the beginning when we were the trial herd, we were ultrasounding calves to see, was the system finding the calves with pneumonia, and then were they getting better after getting treated from being identified with the air tag. So we were doing that for like 6-7 months while we were in the trial process. And then once I didn't need that information anymore now, because I don't weigh calves anymore. I don't do total proteins anymore. Like, I can walk in the calf barn and figure out what's a healthy calf. I mean, you need to know kind of where you're at, what an average daily gain is, but once you do and you're there every day, you have a pretty good idea on where your calves are at. But it's a good tool to find out where you think you're getting pneumonia and if the calves are getting better. That's it. Okay. Thank you.